Post-traumatic stress disorder is a clinical condition that can follow exposure to actual or threatened death, serious injury, or sexual violence. PTSD is common. About 5 to 6% of U.S. adults will experience it in their lifetime, with higher rates after repeated trauma. Symptoms cluster into 4 areas: intrusion, avoidance, negative changes in cognition and mood, and arousal or reactivity. They persist, cause distress or impairment, and are not due to substances or medical illness. In this episode, we'll give a clear evidence-based overview of care, what therapies work when medication helps, and daily practices that support recovery. Recovery from PTSD takes time, and it happens in small, steady steps. Thanks to neuroplasticity, the brain can rewire after trauma. The amygdala's alarm can quiet, the hippocampus helps place memories in time, and the prefrontal cortex strengthens control through practice, therapy, and skills training. Skills like paced breathing, grounding, and gradual exposure retrain safety responses, one tolerable step at a time. Progress is incremental and measurable. Clinicians often track symptoms with tools like the PCL-5 over weeks. Small goals on a calendar, sleep, movement, social contact, build momentum. Hard days still happen, but the trend matters. More calm, more choice, more life. Therapy is a cornerstone of PTSD recovery. It's a confidential, non-judgmental space where your brain's overactive threat detector and unprocessed memories can be gently recalibrated. With a trained clinician, you'll learn skills, process what happened at your pace, and rebuild a felt sense of safety. So your story is no longer driven by fear, but guided by hope. After trauma, the brain's alarm can get stuck on high alert, body tense, mind scanning for danger. Therapy uses neuroplasticity to lower this alarm and update memory processing. You'll practice skills that calm the body, then carefully revisit memories so your brain learns, I am safe now. Let's briefly outline 3 evidence-based options. We'll cover CBT or CPT, prolonged exposure, and EMDR, what they do and what to expect. CBT and CPT target the beliefs trauma leaves behind. Purpose: replace I'm never safe with balanced, accurate thoughts. Technique: cognitive restructuring, writing, and guided worksheets that test and reframe beliefs. Course: usually weekly for about 12 to 16 sessions. Evidence: strong support from APA and VA/DoD guidelines, with lasting gains when skills are practiced. Prolonged exposure reduces avoidance so fear loses power. Purpose: teach the brain that feared cues are not dangerous now. Technique: imaginal recounting of the trauma with support, plus real-life stepwise exposure using a personalized hierarchy. Course: about 8-15 sessions. Evidence: strong with robust results for PTSD symptoms and functioning. EMDR helps the brain fully process stuck memories. Purpose: reduce the memory's emotional charge while keeping the facts. Technique: dual attention with bilateral stimulation, guided eye movements, taps, or tones, while recalling the event in brief sets. Course: commonly 6 to 12 plus sessions depending on history. Evidence: strong, supported by multiple randomized trials and global guidelines. Across these therapies, regulation skills support the work: grounding, paced breathing, body scans, and present moment awareness. These techniques calm the nervous system so memory work can proceed safely, helping your brain learn the difference between then and now. What to expect: weekly sessions, structured agendas, and between-session practice. You set the pace. Consent and safety come first. Many people notice initial relief within a few weeks, with continued gains as skills are used in daily life. If faith is important to you, let your therapist know. Many clinicians respectfully integrate prayer, values, and scripture alongside these methods, aligning treatment with what gives you strength and meaning. CBT, CPT, PE, and EMDR are proven paths to peace. If one approach isn't the right fit, another may be. With steady support, you're retraining your brain, restoring safety, and reclaiming your life, one brave session at a time. For some, therapy alone may not fully quiet the echo of trauma, and that's okay. Trauma can disrupt the brain's chemistry, and medication may help restore balance so therapy can work even better. Think of it not as a magic fix, but as a steady hand, reducing symptoms so you can engage in healing with more calm, clarity, and hope. Two common options are antidepressants. SSRIs, like sertraline or paroxetine, help the brain use serotonin more effectively. SNRIs, such as venlafaxine, also support norepinephrine, which can steady mood and focus. These medicines build gradually. Many people notice benefits in about 4 to 6 weeks, with early shifts like improved sleep, energy, or concentration. Common side effects can include nausea, headache, or changes in sleep, often mild and temporary. Antidepressants carry a black box warning about increased risk of suicidal thoughts in some young people. That's why supervision matters. Keep close follow-up with your clinician. Report any mood changes right away, and never start, stop, or adjust doses without guidance. For trauma-related nightmares, prazosin may help by calming the body's adrenaline response during sleep. Many take it at night. Because it can lower blood pressure, your provider may start low and adjust slowly. Report dizziness, lightheadedness, or fainting, and follow your clinician's instructions carefully. Finding the right medication is a collaborative process. Your clinician will review your history, other medicines, and health conditions, then monitor progress and adjust as needed. This content is educational only. Always seek personalized medical advice. Your safety plan includes regular check-ins, clear instructions, and support between visits. Most importantly, medication complements therapy, not faith replaces it. For many, it creates quiet in the storm, making room for prayer, reflection, and rest. With wise medical care and steady spiritual practices, seeds of hope can take root, mind, body, and spirit, growing toward lasting peace. In this section, we'll focus on practical tools you can use anytime symptoms rise. Think of them as skills you train, like muscles. When practiced regularly, they help your body settle, your thoughts organize, and your day feel more manageable. We'll cover grounding, diaphragmatic breathing, journaling with thought records, leaning on supportive people, and creating a simple crisis plan. Aim to practice daily and track your distress from 0 to 10 to see what helps most. Grounding. The 5-4-3-2-1 exercise. Name 5 things you can see, 4 you can feel, 3 you can hear, 2 you can smell, 1 you can taste. Say them out loud or in a whisper, and gently look around while you count on your fingers. If a sense isn't available, substitute another. Repeat until your body eases a notch on your distress scale. Practice 2 to 3 times a day so it's ready when you need it. Diaphragmatic breathing. Place a hand on your belly. Inhale through your nose for a count of 4, feeling your belly rise. Pause briefly. Exhale through pursed lips for a count of 6, letting your belly fall. Keep your shoulders relaxed. Try 5 minutes, 2 to 4 times daily, and during spikes of anxiety. If you get lightheaded, slow the pace. Many people find pairing this with a gentle visual timer helpful. Journaling and thought records help organize overwhelming thoughts. Note the situation, the thought, your feeling level, and evidence for and against the thought. Then craft a more balanced alternative and re-rate your feeling. Share progress with supportive people, friends, family, or a group. Connection reduces isolation and reminds you that help is available. Let's do one calming cycle together. Sit comfortably. Inhale 1, 2, 3, 4. Pause. Exhale 1, 2, 3, 4, 5, 6. Notice your shoulders soften and your jaw unclench. Repeat for a minute, or as long as it helps. Create a simple crisis plan. List early warning signs, 3 coping steps, people you can call, and professional numbers. Save it in your phone and on a card. Schedule practice in your calendar and track daily distress to spot patterns. Progress is built in small, consistent reps. One skill, one day at a time. Daily healing grows from small routines. Aim 7-9 hours. Same sleep and wake. Dark, cool room. Screens off 1 hour before bed. Move your body. 150 minutes weekly of moderate activity plus 2 strength days. Walk, cycle, or swim. Eat balanced meals. Protein, fiber, omega-3s. Hydrate. Limit alcohol. Keep caffeine to earlier hours. 5 to 10 mindful minutes daily. Take meds as prescribed. Keep follow-ups. Set reminders. Many with PTSD improve with care, often combining therapy, daily skills practice, and, when appropriate, medication. Prevent relapse. Keep routines, sleep well, move, ground daily, and check in early. Seek help if symptoms persist, worsen, or disrupt work, relationships, or safety. In danger? Contact local emergency services now. Quick recap. PTSD is real, and recovery is possible. Effective paths include CBT, exposure, EMDR, and somatic work. Some benefit from SSRIs, SNRIs, or prazosin. Build coping skills, daily rhythms, and a safety plan. For personalized care, consult a licensed clinician. You are not alone. Talk with a licensed clinician to map your next steps. Next, in Volume 3, Supporting Loved Ones with PTSD. Practical, clinical, faith-informed care.